Most international nurses I meet are highly experienced nurses. They've been working for years and sometimes even decades. This means they have a lot of experience, a lot of skills, and professionalism. But when they start preparing for their CBA and SLA, then they start feeling lost. They start feeling anxious. Basically, they don't know where to start and they don't know what to do. It's not because they're not good nurses, it's because they are preparing the wrong way. Their preparation doesn't match what the Inspire Global assessment is going to be evaluating you for and assessing you for. And I want to tell you 3 reasons why IENs are struggling with their CBA and SLA preparation. Reason number 1, memorization over understanding. Many IENs try to memorize everything. They try to memorize every topic, every case scenario. But the CBA and SLA doesn't test your memory. It is testing you how you apply this knowledge into realistic nursing case scenarios. They are assessing you on your prioritization, your delegation, your therapeutic communication skills. So number 2, not fully understanding Canadian expectations. In different countries, there would be different nursing health standard, different scope of practice, and it's the same here in Canada. In Canadian healthcare, they value patient autonomy, cultural safety, and collaborative decision making. And how are you going to apply this knowledge in clinical scenarios during the CBA and the SLA simulation? And if someone doesn't know how Inspire Global Assessment are evaluating these values, it makes sense that you might feel lost and anxious in preparation for the CBA and the SLA. And that takes us to reason number 3, practicing alone without structured guidance. Reading and studying on your own can only take you so far. You might miss key components that are essential prior to your CBA and your SLA. One of my coaching clients told me the other day that before she reached out to me, she was talking to her friends who are also doing the CBA and SLA, and then they were mentioning how they can just study together. And what I told her is a blind man cannot lead a blind man, or else you will both end up in a ditch. And what I mean by that is it's hard to guide someone who is going through the same journey as you, who has the same struggles as you, who also feels lost, who also feels anxious, and who also doesn't know where to start and what to do. And if you're watching this video and the rest of my videos, that's a good start, and that's why I've been creating these videos, and also my online prep course and my coaching program to give you feedback, to give you guidance, to help you focus on what you need to study and clarity on what to expect during the CBA and SLA. And I can help you understand how to think like a Canadian nurse during this assessment, as I'm a Canadian trained and educated nurse for over 17 years. And I want to share with you the framework that I use in my teaching and in my coaching and in my course students, the APP method. Assess, plan, prioritize, and execute. And this is a framework that you can use in every nursing case scenarios in CBA and your SLA, and even when you're working as a nurse. The first one is assess. This is where you gather and interpret the information that is in front of you. So that means when you enter the patient's room, what are you seeing? What are the vital signs telling you? Based on what the patient is telling you, what are the key information that you can use so you can plan your nursing interventions and plan the patient's care plan. Also listening to what the patient is telling you, not only what they are verbally saying, but also their nonverbal cues. Does the patient look anxious, frustrated, or sad? And what does that tell you? How are you going to interpret this information that you can use so you can plan the patient's intervention? I want to take a quick pause on our video to say, I just want to say thank you for watching. Seriously, it means a lot to me. I see you and I appreciate you, and I want to thank you for being part of this community. But I also noticed that half of the people who watch my videos aren't subscribed yet. So if you've been learning something new or you're getting value from the videos I'm sharing, it would mean the world to me if you can share this video to someone you care about and someone who can benefit from watching this video. It's free for you, but also you're helping another IEN who might feel lost and anxious right now. This also helps me create more videos like this one to help support you on your nursing journey here in Canada. Thanks again for being part of this community, and I'm so glad you're here. Now let's get back to the video. Next is prioritize. Once you have all the vital information that you need, you have to start prioritizing what is the patient's urgent need. You can use frameworks such as the ABC or airway burning circulations. You can use Maslow's hierarchy. Basically, with every decision that you are making, you have to justify why you chose that decision over this decision. Why do you have to call a doctor first before giving medication? Or vice versa. Can you give this medication first before calling the doctor? Having a reason behind your choices or decisions is what they are assessing during your CBA and most importantly during your SLA, as this is how they are assessing your critical thinking skills. Next is plan, and this is when you develop evidence-based, patient-centered interventions. Think about nursing diagnosis. What are your goals for this patient? Who are you collaborating with? Who are you going to refer this patient to? And what kind of discharge teaching are you providing to this patient? And when you are developing and planning your interventions, you have to ensure that it is aligned with the Canadian standards and also your scope of practice. For example, you're an RN, LPN, or RPN, then you have different scopes of practice. Lastly is execute. You have to carry out your plan with professionalism. And when you are providing interventions, you also have to think about how you communicate this to the patient. And when you're talking to the patient, think about your tone, your body language. Are you actually listening to what the patient is saying? And you are providing compassion, empathy, professionalism. During your SLA, most especially, it's not just about what you do, but also how you do it. And when you use the app method, assess, prioritize, plan, and execute, this will give you structure. This will help guide you, and this can apply in any nursing simulations that you will face. Mental health, medicine, post-op, community, maternity, pediatrics, any simulations, you can use this framework and you'll be able to explain your decisions clearly. And that's what success can look like during your CBA and most especially your SLA assessments. So if you're preparing for your CBA and SLA, you already have the knowledge, you have the experience. What you need is focused studying, structure, and proper guidance. And if you need more assistance with this, feel free to go to my website, www.nursingcollective.co, where I offer my online prep course for IENs to give you the structure and guidance to help you be successful in your CBA and SLA. And also right now, I'm offering a group coaching for IENs preparing for a CBA and SLA. So if that is something that you are interested in, go to my website and you can find out more details about that. In the meantime, I want to remind you, you don't have to feel alone. You're not the only one going through this. I'm cheering you on and I believe in you. Thank you for watching and I'll see you in the next video. Bye!
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!